Good afternoon, everyone. Lieutenant Governor Houston and I and Fran had a great time in Lordstown yesterday. We're very, very excited about what we're seeing coming out of the Mahoning Valley as far as new pickup truck, all-electric pickup truck, and it's an exciting time. Today I'm wearing a tie from Franklin University. Since 1902, Franklin University in Columbus has been an innovator in providing education for adult learners. The university offers applied in-demand undergraduate master's and doctorate programs that enable adult learners to achieve their education and their professional goals. My good friend, former State Rep Ross McGregor, is a graduate, as is my good friend Nino Vitale. So we're happy to say hi to all the alumni. On a very sad note, I'd like to pause and remember the life of 28-year-old Marine Sergeant Wolfgang Kyle Weninger. The sergeant died in a military training accident last week. Growing up in Geauga County, he was a student athlete. He was a leader. As a Marine, his commanding officer described him as smart, dedicated, dependable. I have ordered the flags lowered at the State House and in Geauga County in honor of his life and service until the day of his burial. And Fran and I have also lowered our flag at our home. My deepest condolences go to his mother and stepdad, Michelle and Scott Henry, his father, stepmother, Ernst and Dawn Weninger, as well as his siblings, Drew, Milo, and McKinley. Today's numbers show a big increase in cases in Ohio. We have seen continuing increase or higher numbers for the last week. We're showing an increase of 892 cases reported since yesterday. This is the fourth highest day of cases we've noted by report date. The earlier days were April 18th to the 20th, and those included significant testing in our prisons. So this is, in essence, the highest number, in a sense, that we have had. It is important to note that in today's case increase, almost 60% of these individuals are in the 20 to 49-year-old range. Hospitalizations are up by 55, and we'll look at the total chart starting at the bottom. If we look at last 24 hours, ICU admissions 11. The 21-day average is 13, so that's holding steady. Hospitalizations last reported 24 hours, 55. 21-day report is 57. That's fairly steady. The deaths, 17. 21 is the 21-day average, so again, fairly steady. But the early indicator, of course, is the number of cases. Now, we'll talk in a moment about we have increased testing, but no analyst that I have talked to believes that the total increase is due to that at all, and we'll get into that in a little bit. Let me turn to the total testing slide, positivity slide. This is as I said on Tuesday, we're going to continue to make more data available on our coronavirus website. This information is up there. Earlier this week, we started posting the number of tests performed and the percent positivity on the dashboard. So we will update this every day. A caution. This is because of the way the numbers come in. Let me get the date here. We've got a date that's several days actually behind. So the last date. This is actually dated for tests on the 23rd of June. 23rd of June. And the tests on that day were 17,091. So you can see this is a new high for tests. We're happy about that. It's not where we want to be. We need to get much higher, but we're getting great cooperation from people around the state. A lot of people are engaged in getting this testing up. And as I've said, as we look at this problem, there's two things that we can do. One is more testing and more tracing and separating this virus so it doesn't spread. And the other thing, of course, that we can do is how each one of us, what we do out there, washing our hands, wearing a mask, keeping our distance, basic things that we have been talking about. So those are the numbers. Again, we'll show this number here. This is the positivity rate. It's been between 4 and 6. It's holding in there at 5. So in spite of the significantly increased testing, the positivity is holding there at 5. Let's look, Eric, at the age slide. We're seeing this across the state, and frankly, in talking to governors the other day on a call with the vice president, a number of them said they were seeing the same thing in their area. See, as you can see from this chart, the average age of people who were infected in March was 51. And you can see these are the March numbers. Eric, let's see the next one, if we could. Well, so far in June, that number has decreased to 42. I'm sorry, just looking at a different note. So you can see what's happened. The age has gone down month by month by month, or at least for the last couple of months. So the average age of the people who are testing. The trends that we just talked about are trends that we're seeing in Hamilton County, and we want to focus a little bit today on Hamilton County because our guest is Dr. Rick Lofgren from UC Health, and he's here to talk to us. He's the president and CEO of UC Health, the University of Cincinnati's affiliated health system. Doctor is an internal medicine physician with almost 40 years in healthcare, including working in Kentucky, Wisconsin, Pennsylvania, Minnesota, and Michigan. I've asked Dr. Lofgren to spend some time today talking about what he is seeing and what they are seeing in Hamilton County. Quite frankly, what he's going to describe to you is some trends that are moving in the wrong direction. Certainly not what we want to see. But he'll talk to you about it. And Dr. Lofgren, thank you very, very much for joining us. I see you are there, I guess, in your office. So thanks for joining us.
Thank you, Governor. And I want to thank you for your leadership and your remarkable steady hand through this pandemic. It's really been phenomenal. You know, after the initial introduction of this virus in our community, Hamilton County and the surrounding areas really have done an incredible job of slowing down and containing the spread of the virus until, unfortunately, the last 10 plus days, where we've definitely seen an uptick or a spike in the number of new cases. I wonder if I could have the first slide.
Up, Doctor.
Great, thank you. So what you see here is the R factor over time in Hamilton County. This is the effective reproductive ratio. I know you've touched upon it on your previous updates, but just to remind people that this is a number that tells you the number of people that an infected person will in turn infect. If the R factor is below 1, it indicates that the virus is being contained. But if it's greater than 1, it really indicates that the virus is spreading in your community. At the peak of the pandemic, we could see in the early part of April, in our region, our R factor was 2.4. But with the social distancing and the interventions, we saw the R factor decline. And over the last several weeks, our R factor had been below 1, which means that the virus was in our community, but it was no longer spreading. However, more recently, our R factor has increased to nearly 1.5 and actually has doubled over the last 10 days. If I could have the next slide.
All right. All right, Doctor, the slide is up, and you and I talked a little bit about this slide, and for those of us who live in Ohio, we might be a little confused by this slide, but I'm going to point to the Ohio River, and you can kind of describe the outline here. If my arm is long enough. So basically you have 3 counties in Kentucky. Oh, I see you have them labeled. Thank you. That's good. So we can see part of the 3 bottom counties are Kentucky, and then I believe we also have Indiana in there as well. So why don't you go ahead and describe it, Doctor?
Yeah, so what we show here and what I wanted to depict is that this increase in our R factor is really in the region itself. So in the middle of the slide, you see Hamilton County. And each one of the counties that's in red tells us that their R factor is significantly above 1. To the north of us in Ohio is Butler County, and to the east is Claremont County. Just as the governor explained, to the west is Dearborn County, which is in southeastern Indiana. And then the 3 counties in the bottom are the counties in northern Kentucky. And obviously, we're a community, and so you can see that this uptick in the R factor is, in fact, in the region, but has most notably been increased in Hamilton County as well. If I could have the next slide.
And you've got also, Doctor, as I'm looking at this, it looks like Claremont County is close to 2 now. So Claremont is up there pretty well too. So.
Yeah, the only thing I'd mention about that one, Governor, is that
smaller numbers.
Lower numbers, exactly. So it's a little bit more, it fluctuates a little bit more, but it is a significantly above 1. So again, recognizing it's in the region. The counties that are in the tan color are actually below 1. And so it really does show the concentration in the greater Cincinnati, the region here.
All right, next slide, Eric.
Yep, next slide.
All right, it's up, up, Doctor, it's up now.
Okay, thanks. And I'm going to walk you through this. It may look a little complicated, but what we were seeing is we're also seeing a more modest but a definite increase in the number of patients or individuals that had to be hospitalized because of COVID. Each one of the blue dots represents a day, and it really goes from the beginning part, the latter part of March. And you can see that the number of patients that were hospitalized in our region, this is the Ohio region. Let me be clear about that. This is just Southwest Ohio, increased into the peak in sort of middle of April. And since that time, we've seen a steady decline, as you see by the blue dots coming stepwise down. Then you can look at the last 10 dots. You can see that the line is straight up in terms of number of patients or number of individuals who have become infected with COVID that's required hospitalization. And the gray bars just tell you whether or not it's beyond random variation for the statisticians in the room, which means this is a real uptick that's beyond just random variation.
Thank you.
If I have the next slide then.
It's up now, Doctor.
Great. And this is really the same information, but this time it's just confined to the individuals who are critically ill and required to be in an ICU. So again, each blue dot represents a day. And on the left-hand side is the number of people who happen to be in an ICU given that day. And what you see, really a nice decline throughout May into early June. And then again, if you look at the dots in the far right, we've been doing well. And all of a sudden you see this uptick in the last 10 days of patients who require ICU care as well. So we've definitely seen an uptick in the number of cases, but also seen a modest but real uptick in both hospitalizations and ICU cases. If I could have the next slide,
All
then.
right. It's up, Doctor.
Great. And I think this really highlights one of the points that, Governor, that you just mentioned about the real shift in the people that are testing positive. So what you see on the left-hand side is the number of cases and positive test results that we got by age. And so on the left-hand side, in the week of May 31st, you can see that the distribution is actually pretty even across all the different age groups. There really wasn't a particular age group that has stood out. But looking at the distribution of the positive test results on the graph on the right, you can see that we've actually seen a dramatic increase in the number of people who are testing positive in the age group of 20 to 30, and again, some degree in terms of the age group of 30 to 40. We've clearly seen a shift in terms of younger people who really are driving this increased number of cases. Very consistent with what you were seeing around the state and also, I think, around the country. The next slide then.
It's up, Doctor.
Great. Again, I realize this is a bit complicated, but I think it's an important point. So what you see on the left-hand side is the percentage of patients who were tested in that age group who had a positive test result. So you just look at the line, if you just look at the line, you notice that throughout April and May, just about 10% of the people in the age group of 20 to 30 had a positive test. Then we saw in early part of June that the rate of the positive test went down. This is what we might expect to see if we start to increase the testing that you've mentioned, Governor, that's happening, because we would test more and more people that would not have symptoms, and therefore we'd expect that the percentage of people with a positive test would go down. And then you can see in the latter part of June that it's actually gone back up, and actually at this point in time, we're seeing about 14% of the tests in this age group come back positive for COVID. What I've shown you by comparison on the right-hand side is what we've seen in the age group of 60 to 70, which is really what we've seen in all the other age groups. Again, in the early part of April, we were seeing a positivity rate of about 12 because we really were only testing people who were quite sick. You saw that drop in May, and actually in June, you've seen a drop in below 5%. So going back to the point about this uptick of the percentage of individuals who test positive in the younger group, this is really indicative that the increased number of cases we're seeing is not just because we're doing more tests. It really does, in fact, indicate that there is more disease and more disease that's spreading in our community. So one of the things that we have, and I'm actually done with the slides if you'd like, but one of the concerns we have is that we are seeing this big uptick in younger patients. And as you know, younger patients tend not to have as much complications as older patients. But we're concerned about the younger individuals in our community, particularly those who might be infected and have no symptoms, who in turn might infect older individuals or individuals who are more at risk of developing complications from COVID. And so we're keeping a close eye in sort of the next 14 days, whether or not we're seeing some sort of a rebound infection, if you will, as the result of this uptick in infection in younger adults. In response to this uptick, Commissioner Moore of the Cincinnati Department of Health and Commissioner Kesterman of the Hamilton Department of Health have been increasing the testing availability, particularly in those neighborhoods where we've seen an increased number of cases, and really are busy doing the appropriate amount of contact tracing so that, in fact, we can understand the disease, identify cases, and isolate them and contain them. But I think this uptake also reminds us about the importance of maintaining safety measures so that we can prevent the spread of this virus in our community. You know, this virus remains in our community, but we certainly can safely live with this virus as we continue to open up our economy and open up our lives. But in order to do that, we need to be vigilant and really understand the importance of social distancing, the use of universal masks. Masks are very effective in preventing the spread of this virus, particularly from asymptomatic individuals. But to really be effective in the community, it really needs to be done by everybody so there isn't any chance event that we have an inadvertent or unknowing spread of this virus to more susceptible individuals and individuals who may have complications from it. It's also important that we continue to be very vigilant about washing our hands, sanitizing surfaces that are commonly used amongst many people, and to make sure that if you are infected, that you stay home, that you isolate, that you take care of yourself. So it sort of summarizes what's happening in the greater Cincinnati, Hamilton County area. Again, we've seen, I think, a real uptick in the number of cases. It seemed to be way disproportionately in younger adults. We are still seeing some increase in the hospitalization. It really does tell us that this virus is having a bit of a comeback. The positivity rate in younger adults also suggests that we're seeing actual more spread in the community, which just means it's so important that we actually as a community really recognize that the simple safety measures that really reduce the spread in our community are both needed and will be highly effective so that we can get our R factor back below 1 and really contain the spread of this virus.
Doctor, that's a great report, kind of chilling report, but thank you for a very comprehensive report. So do you have any, do you know why, or can you, based on science, give us some idea of why are we seeing this with young people?
You know, we don't have a lot of good information and data per se. And as we start to learn more through the contact tracing, maybe we'll have more insights about why we think that people might be acquiring the infection. You know, it really is younger adults tend to be a little bit more risk takers. So maybe part of the generational elements of this. But we really need to understand more and have more information before we really can conclude what it is and why it is. But we do know the importance of identifying individuals, making sure they're isolated, making sure we're contacting anybody else that we can mitigate and prevent the further spread of this virus in our community.
Well, I know you and the city officials, Mayor Cranley, county commissioners, as well as 2 health commissioners are really focused on getting more testing. So that is obviously very important. For those of our viewers, Doctor, who are not from Hamilton County or who are not in any of the counties that you just showed up there, is there a message for them as well? Because can they look at this and say, well, it's a unique Hamilton County problem, or what's it mean, if you can if you know?
I'm sorry, I didn't quite hear the question, Governor.
Yeah, well, the question really is, if I let me say it a different way. If I live in Columbus, or if I live in Toledo, or if I live in some other area of the state, we focused today on Cincinnati. Your data, of course, is from Cincinnati, but is there any message for everybody else?
You know, I think the message through all of this is that, you know, at this point in time, we don't have the ability to eradicate the virus. It is in our community. There's still people who are potentially at risk of becoming infected. And so this really highlights the importance in every community to maintain the relatively simple safety measures that we know will prevent the spread in the community. We've done a great job. We brought down the spread in our community through a whole host of things. But again, maintaining social distancing, making sure that you're not in contact. I think it reminders that, unfortunately, there are people who are infected who don't know they're infected and actually can inadvertently spread this virus, which is why maintaining the 6-foot distance and using a mask will really prevent that from spreading, as well as continue hand hygiene alike. So regardless of where you are, you know, and I think a lesson even from Hamilton County is that we're doing and have done a great job. But you can't let your guard down. This virus is still in the community. We still need to be sure that we're practicing all the safe measures. And if we practice those safe measures as a community, we can live safely with this virus in our community and, again, open up our economies and open up our lives.
Doctor, as far as young people, this will be my final question. Again, thank you very much. But as far as young people, we've seen that by and large, unless they have a medical problem, most of them are going to get through this okay. What is the fear then of a lot of young people who are coming down with COVID-19?
You know, a number of people with COVID-19, particularly younger, are going to have milder disease or even asymptomatic disease. But I think it should be still recognized, even amongst young adults, that it can be really a serious disease and that people who have recovered from it actually have some ongoing problems. Some patients who recover from the disease still lose 20-30% of their lung function. So I don't think we should underestimate or think that this is kind of a benign disease. In fact, I'll just share with you that the last patient we had that was admitted to UC Health and required ICU was a 28-year-old individual without any pre-existing conditions. Now that's the exception than the rule, but the point being is that it is still a a very serious infection, and one in which we can, again, control by using all the appropriate safety measures.
Doctor, thank you very much for your time. We know you're very, very busy, and thank you for what you do every day for your patients and for the patients that you see. So thank you. Thanks, Doctor.
Thank you, Governor. I appreciate you having the opportunity.
Thank you. Today, we're excited to announce the addition of 2 new Kroger retail testing locations, one in Dayton, one in Cincinnati. In addition, Walgreens has announced 3 new retail testing locations in Cleveland, Marietta, and Centerville. We certainly appreciate what they're doing, and we hope for more. For exact locations and to find other sites near you, visit coronavirus.ohio.gov. Our pop-up testing is focused on underserved areas, particularly minority communities. However, testing is open to anyone. Anyone can come in. As far as these sites, it is free. We're adding locations where we're seeing an increase in positive cases, and so this testing is important. I know yesterday in Xenia, I think they had over 900 people, so it's a great thing. Thanks to Greene County for turning out. Tomorrow we have a testing location in Columbus at the Department of Public Safety on West Broad Street, 8 a.m. to 1 p.m. On Monday, we have pop-up locations coming Monday in Lisbon, Canton, and 2 different sites in Cincinnati. On Tuesday of next week, we'll have 2 sites, Cincinnati and Bowling Green. On Wednesday, we'll continue to have sites in Cincinnati. Finally, on Thursday, we'll have another testing location in Cincinnati and one in Circleville. We'll be adding more testing locations, so continue to check the coronavirus website at www.coronavirus.ohio.gov and click on Testing and Community Health Centers tab at the top of the page. 211. 211 is a phone service that connects thousands of Ohioans to local nonprofit and government services, including those for health care, food, meals, housing, transportation, mental health, and legal services. 211. At the beginning of the year, the service was available in 51 of Ohio's 88 counties. When the pandemic began, Ohio EMA asked Ohio AIRS, the nonprofit that governs Ohio 211, to provide service to the additional 37 counties in Ohio. Ohio AIRS expanded these services in March, and today I'm happy to announce that the Ohio Department of Health will continue funding for this valuable service as we enter into the next phase of the pandemic. Often people in need require help getting connected to all kinds of different services. We know that the need has grown remarkably during this unprecedented time. 211 service is particularly important for those most vulnerable in our state who have been hit by COVID the hardest. Any Ohioan, wherever you're in the state, can dial 211 or 877-721-8476 if 211 dialing isn't available from your phone. And that is all good.